So now we are going to examine about comparative percussion and topographic percussion. So comparative percussion can be done anteriorly, laterally and posteriorly. So anteriorly from supraclavicular fossa, both the sides, we have to make a hand position like this. We have to check it like suprascapular fossa, and below the scapula, infrascapular fossa. And here at the second rib, here at the second intercostal spaces, as the sternum is here, and after the third intercostal space, we should not continue our percussion on the left side because of dullness of the heart. Because as the left side consists of heart, it consists of heart here. So here, if we do the percussion, the vocal it did not be like proper on both the sides. So it is done. It is not continued on the left side because of the dullness of the heart. So we have to continue on the right side. On the right side till the fifth rib, till the fifth intercostal rib, till the fifth rib we have to continue our percussion on the right side instead of left side. Till third rib we have to continue on both the sides. But after third rib, we have to continue only on the right side. So on the lateral aspects, we have to do percussion on both the lateral sides. So till here, as this is the second intercostal space, this is a third rib which continues here. So this is a third. We have to do third, fourth, fifth. So till the eighth ribs, we have to continue a percussion on both the sides, so both the lateral sides. So on the posterior side, we can notice here the spinous process of the seventh cervical vertebra. So above the scapula, we have to do percussion above the scapula. So and from between the scapula, between the scapula, we have to do a percussion between the scapula. So from the inferior aspects of the scapula, from the inferior aspects, so from inferior we have to continue our percussion from the inferior to the scapula till the 10th rib. Till the 10th rib we have to do our percussion till the 10th rib in the posterior aspects. So this is about comparative percussion. The topographic percussion. So the topographic percussion is used to determine upper and lower borders of the lungs. So the upper border of the lung, the upper border it is determined by placing a finger parallel to the clavicle. So the finger which is parallel to the clavicle, this is the front border of the lung, and the back side from here, the lung, the upper border of the lung, from here the lower region of the clavicle to the back side, to the fingers which are placed over the supraspinous fossa. This is the supraspinous fossa, this region, supraspinous fossa, parallel to the scapular spine. So carried out upwards medially slightly. So this is like this region from here to here. So here, this is called as upper border of the lung. These regions are called as, from here to back side, this region, it is called as upper border of the lung. And lower border of the lung along topographical lungs. So the right percussion, this is left and this is right. The right percussion, it starts from parasternal line. As I mentioned anterior, this is called as mid-sternal, and this is here this is sternal, and this is parasternal. This is a parasternal line. So the right percussion starts from the parasternal line, and the left percussion starts from the anterior axillary line. So as I mentioned lately, here this is the mid-axillary line, and here this is the anterior and posterior axillary lines. So the left percussion starts from the anterior axillary line which is present here. Thank you.